Hi again. Sorry for the delay. I expected to get this second post out much earlier, but I actually wound up going away from Monday through Friday, so I was busy and I just didn't have time to update the vlog. Going away was actually an interesting experience. I wanted to get one last road trip in, so I went up to the Providence, Rhode Island, Boston, Massachusetts area to visit a couple friends, and we just, tried to do some normal things, going downtown, getting some stuff to eat, celebrating the 4th with some friends, nothing too crazy. But despite that, I was in pretty terrible pain, and it really just reaffirmed everything that I'm doing with this surgery. And I'm sure a lot of people going through surgery get to this point where they're thinking, do I really need this? Do I want to endure the pain and the recovery? And my answer is very, very surely yes. And this past week really just solidified that I wasn't even able to do normal things with my friends. So I wanted to update you guys on my pre-admission testing that I mentioned in the last vlog. It was on Monday and I went up to the hospital for about 2 hours. They had me filling out some patient paperwork full of my past medical history, and it reminded me of some things that I had long forgotten about. Then they took me in to draw some blood, and it was only 4 vials, so it wasn't a big deal. I gave a urine sample, and then another nurse took me in to perform an EKG. And if you haven't experienced that before, it's super simple. They just lay you down on a hospital bed, and they put 10 little sticky electrodes on your arms, your ankles, and your chest. Then she attached some wires to those stickers, and the actual EKG took about 3 minutes or so, and it produced a printout. She said everything appeared normal, and then she sent me down to the X-ray technician. The 2 chest X-rays were also no big deal. One I was just standing up against with my chest to the X-ray plate, and the other I was standing on my side with my arms raised and holding onto a bar. Something I thought was interesting and possibly a funny anecdote to share with you guys is that each nurse that helped me with the different steps, they asked, what happened? You're so young. What was your injury like? And that's really the response I get out of most people when they hear about my back and that I'm only 24. They assume I've gotten into a car accident or I had a major fall, but truth be told, I just woke up one morning and it was herniated. It wasn't a stressful night the day before. I was actually dog sitting, so it was just me alone on a pull-out couch with a very old golden retriever. So he wasn't pulling me or making me go for a jog or anything like that. It was a very stress-free experience, and I just woke up and I couldn't move. So I have my own theories as to what happened with my back. I matured very early and I developed a large chest very early, so that put and it continues to put, I'm sure, a very large stress on my back. I've also had very labor-intensive and strenuous jobs over the years, since I was 14, really, and those jobs involve a lot of bending, lifting, and twisting, which are the major contributors to this type of herniation. I worked at dry cleaners for 5 years, so I was lifting heavy clothes all the time. I also worked at a kennel, and that involved lifting and carrying dogs all the time, as well as cleaning their enclosures, so bending and twisting to maneuver to do that. I worked at a university center where I was doing event setups and breakdowns, so moving and lifting chairs and tables, so not easygoing office type jobs. So I'm sure that those all contributed in combination to the weakening of that disc space and its herniation. So that brings me to some of the questions I've received about the surgical risks and the recovery process. So as with all surgeries, there's risks involved in undergoing general anesthesia and surgical site infection. And like I mentioned in the last video, I'll have 1 incision in my side and 6 small incisions in my back. So I have to be very diligent about taking care of those. There's also risk of muscle and nerve damage. They're going to be monitoring my nerves at all times during the surgery to try to avoid them. But if something is nicked, the most common injury to the nerves is one that causes a burning sensation in your thighs. And that resolves over time as the nerve heals itself. As far as muscle damage, my risk isn't as great because it's minimally invasive as some of the other spinal fusion options like the TLIF or the PLIF, since they're not opening up my back and they're not opening up my abdomen. They're just going to be opening my side, and they'll actually be weaving through the fibers of the psoas muscle. So that means the muscle damage risk is very low for me, and that means that my surgeon doesn't think I'm going to need PT, and he doesn't think I'm going to need a brace following surgery, which is really great. Another risk is phantom pain, and that's something I'm a little bit concerned with because it has been 3 years, and that might be long enough to build up that neurological imprint, but I don't know, and it's a small risk at that. There is also a risk that's very specific to my own situation because I am so young. There's a greater likelihood that I'm going to herniate the discs at the levels above and below my fusion spots, so at the L3, L4 and the L5, S1, and that's because the L4, L5 is going to be immobilized, and that's going to put all the pressure and stress on those levels above and below. But my surgeon said that if that happens, it's going to be when I'm in my 50s or my 60s. And so as I see it, I'm 24 now. That's another 25 years at least, so my entire lifespan up to this point that I hopefully won't have any more disc pain. So that's a risk I'm very, very, very willing to take. As far as recovery, one of the main reasons I was interested in creating this vlog was because I was looking things up and I couldn't really find anything that was specific for DLIF patients, and I don't know, since it is minimally invasive, if that's going to make my recovery process a lot different from other people that underwent the different types of spinal fusion. So that's really to be witnessed, what's going to happen. I can tell you about the restrictions that they've told me for post-op. One is that I won't be able to drive for 2 to 3 weeks after the surgery, and that's due to the fact that I'll be on painkillers and in pain, so as to influence my judgment and decision-making skills, and they don't want to put me out there on the road at the risk of other drivers and other people in that impaired state, so completely understandable. That's why I wanted to get my last road trip in. Also, the big one is BLT, which stands for bending, lifting, and twisting. I can't bend at my waist, lift more than 5 to 10 pounds, or twist for 3 to 6 months following surgery. So that's actually a really big deal, and you don't realize how many things in your life involve bending, lifting, and twisting until you're trying to make a conscious effort not to do those things. So trying to put on your jeans, trying to refill your pet's food and water bowls, they all get pretty complicated when you're not allowed to engage in those motions. I'm luckily going to have help for the first week or so. My sister is actually she's taking the train in tonight, and my father is flying in tomorrow, and between the two of them I'm going to have great support, and I'm really thankful for that. What else? Exercise. They say also no strenuous exercise for the first 3 to 6 months, so beyond walking, and that's something that might affect other patients, but it doesn't really affect me because I haven't been able to engage in anything more than that anyway because it causes a lot of pain, and I'm hoping that with the fusion, walking is going to be a lot easier for me, so I'll be in a much better position overall. The return to work is something that's individually based as well, and it's something that I'm going to need to consider because I am currently job searching. I'm hoping that it's not terribly long because I need to get a job relatively quickly, but that's something that I'll see as time goes on. So now I'm just 2 days away from surgery, and I'm really trying to focus on making sure everything is ready for when I get back. So the next 2 days are going to be full of cleaning and doing laundry and making sure the state of my house is in a position where it can decline at an acceptable rate and not turn into a total hovel while I'm recovering and not able to, do the upkeep that I would hope. I'm also going to be preparing meals so that my caregivers can just reheat or assemble food for me, and it won't be a big task for them. I have to bathe my dogs because that involves bending, lifting, and twisting, which I won't be able to do for a long time. I'm also trying to get in some fun meals and some activities, just trying to enjoy my last 48 hours or so before surgery. I've had a couple of rough moments throughout the past week where I get scared and worried, but I know consciously and rationally that it's going to be a great thing for me. But I think anyone undergoing surgery has those thoughts. But I'm just trying to stay positive. I know that I have a great support system, and I really do have high hope that I'm going to be able to live the life I want and to get more out of my day-to-day and to be free of pain. So I guess that's it for now. I don't foresee that I will be making another vlog before my surgery unless I receive some more questions. I'm going to try to have my sister take some funny coming off of anesthesia videos and maybe snap some pictures of my hospital gown and cap, and I can figure out how to incorporate those into these vlogs to give you all a little laugh. Otherwise, I'm going into surgery on Monday, July 9th. I'll be going to the hospital at 10. They want me to arrive 2 hours prior to surgery so they can get me ready. And my surgery is at noon. It should take about 2 hours. The first hour is on my side while they do the microdiscectomy and the laminectomy, and then they'll flip me over onto my stomach, and they'll perform the subcutaneous placement of the pedicle screws and the rods, which will secure the disc space. So I guess that's it, and I'll be seeing you post-fusion. So keep your fingers crossed for me and wish me luck.